for the disturbance. I am, you know, some craziness is going on, so I was busy there. First year exam. Can you listen? Is it? Yeah. So we talk about development of respiratory system. As you know, most of the system, almost all the systems of the body, they start to develop in week 4. In week 4. Either it is urinary system, urogenital system, GIT, I'm not talking about cardiac, musculoskeletal system, or this one respiratory system, central nervous system. They start to develop week 4. Week 4 means after fertilization. We count these weeks after fertilization. From the week, from the day of fertilization, 4th week they start to develop. But cardiovascular system, week 3. It starts to develop week 3, and even at the day 23, heart starts to beat. That's another story. Maybe Shahzad teach you about this. Okay. Anyway, today we talk about the development of the respiratory system, how trachea, larynx, trachea, and these air spaces, air passages, they are developed. We talk about them, from where they actually develop, we talk about them, and then most important part in this is maturation of lung. Lungs, they develop, but how do they mature? Lungs are not matured until several years after birth. Several years after birth, lungs are not matured. By 7 to 8 years of age, lungs are complete like in adults. Before that, they are not mature, they are not complete, still developing. During development, when fetus or embryo do not take air inside, of course there is no air inside, there is fluid inside, amniotic fluid, in which the embryo is or fetus is floating. Movements of respiration, contraction of the lungs, they take place even well before birth. Well before birth. What is the function of this movement? To give practice to the fetus that it may breathe just after birth. Second, it gets, when the baby is floating in the fluid, this fluid, amniotic fluid, it is ingested. It is ingested in the GI tract and respiratory tract both. So we can say the developing lung or developing air spaces, they are filled with the fluid. They are filled with the fluid because this fetus is not respirating. It cannot respirate. These lung movements, they bring the fluid in and out. So the lungs are collapsed organ and they are filled almost with the fluid, the amniotic fluid before birth. How this fluid has been removed, we'll talk about this. So all this we talk today in the maturation of the lungs. Lower respiratory organs we call larynx, trachea, bronchi. Lungs begin to form during the 4th week, as we discussed. Respiratory primordium, primordium means premature respiratory system, is indicated by a median outgrowth. Median, I need one paper. Median outgrowth, leave it, he's giving me. Median outgrowth from the caudal. What do you mean by median? Median. Median. In the middle. It's not medial, huh? It is not medial. There is a difference between medial and median. Median means in the center, in the midline, right? Median outgrowth from the caudal. And caudal, what is caudal?
Yeah, dorsal, inferior.
Inferior, lower. lower. Caudal is lower, cranial is upper. Upper is also known as rostral sometimes. Upper is sometimes also known as rostral. So ventral is anterior. Cephalic is also near to the cephalic, this area. Okay. So caudal is lower. Why do we don't call lower and upper or superior or inferior here? Why we don't call? Why we call it caudal, rostral, cranial, cephalic? Why?
That's fully developed, yeah. Because
it is developed. The fetus is moving. Head sometimes comes down. So how it could be superior? It is inferior, that, isn't it? Head is sometimes lying in this position, transverse position, so it cannot be cranial. So it cannot be superior or inferior. So we put it wherever is the head is the cranial. Either the baby or fetus is upside down. Cranial is cranial. It cannot be inferior, isn't it? That's why in embryology, until the baby is born, we don't say superior or inferior. We call cranial, rostral, cephalic, caudal. Similarly, anterior we call ventral. Posterior we call dorsal. We don't call it posterior because sometimes it comes anterior. So a bit tricky, huh? So what does it say? Primordium indicated by a midline outgrowth from the caudal lower of the ventral wall, anterior wall. Median, lower, ventral. Midline, lower, anterior. Got my point? Wall of the primordial pharynx. Initial stages of the pharynx. Pharynx is a tube-like structure in you, isn't it? Pharynx is a tube, not completely rounded, but it's tube-like structure. If I compare pharynx like this tube-like structure, I'm not wrong, isn't it? Isn't it? So what does this slide say? Indicated by median, caudal, lower, ventral in this area, anterior, isn't it, of the pharynx. Got my point? This is what this slide says. It is primordium of the tracheobronchial tree. Name tells you. Tracheobronchial tree. The endoderm lining the laryngotracheal groove gives rise to bronchi and pulmonary epithelium. This endoderm, it gives rise to pulmonary epithelium. Epithelium of respiratory system, it is derived from the endoderm. How many germ layers are there? What are those? When you tell these germ layers, be in sequence, either endoderm, mesoderm or ectoderm mesoderm and endoderm. Okay, when you understand. This is pharynx. Look here. I open the pharynx. I open the pharynx and looking it from inside. Got my point? Pharynx was a tube. I opened it like this, and from behind I am watching it as you are watching this picture in this way. Okay? So from inside it appears like this. From inside in the pharynx, this area, a small groove appears. Laryngotracheal groove. Laryngotracheal groove. You can understand this groove will form larynx and trachea. Name is telling us the story, future. You can see in these four pictures how it develops. Small slit, improved, increased laryngeal inlet. If we look it from outside, you know from inside now, okay? If you look it from outside, again this is pharynx, this is pharynx. By the end of the 4th week, the laryngotracheal groove has evaginated to form a pouch-like respiratory diverticulum or lung bud. Respiratory diverticulum or lung bud, pouch-like structure. Clear? By the end of the 4th week, the laryngotracheal groove have imaginated to form a pouch-like respiratory diverticulum, or it is known as lung bud. It is located ventral to the lower part of the foregut. Pharynx is the part of the foregut. Larynx is the part of the respiratory system. Okay, mind this thing. Pharynx is not a respiratory organ, although it carries the gas, air, but we consider it as a actual respiratory passage. Lower passage, it starts with the larynx. Upper, yes, pharynx is included, nose is included, right? But lower respiratory passage, it starts from the larynx, not the pharynx. So that's why we consider pharynx in this case as a GIT, not the respiratory. So it is located ventral to the caudal part of the foregut. This diverticulum elongates and its distal end elongates to form globular tracheal buds. A small pouch, globular bulb-like structure, tracheal buds. This tracheal bud divides into two. Tracheal bud divides into two, right and left. When it divides into two, primary bronchial buds, right bronchi, left bronchi, bronchus, main bronchus. Then gradually it keep growing, it forms the These structures, they form the air passages, main bronchus, segmental bronchi, tertiary bronchi, bronchioles, they all are formed from this bronchial bud. Then, this structure is surrounded by mesoderm, the middle layer. In this area, we call this mesoderm as mesenchyme. Mesenchyme. Connective tissues, they are known as mesenchyme. This connective tissue, they surround the respiratory passages. This connective tissue, they form the muscles of the respiratory system, trachea and larynx and other. And they also form the cartilages. Cartilages are formed from mesoderm, isn't it? Muscles are formed from mesoderm, isn't it? Connective tissues, they are formed from mesoderm. So this is how lungs are formed. Respiratory diverticulum, pouch-like structure. This diverticulum becomes larger. We call it tracheal bud. This tracheal bud divides into two portions. We call it bronchial buds. These bronchial buds are the primordium or preliminary structures of main bronchi. They keep growing into tertiary and segmental and tertiary and other bronchi. Connective tissue around these structures, they form the muscles of the larynx and trachea. Connective tissue around these structures, they form the cartilages. This is the respiratory system, how it is developed. One interesting thing during this development now. If you see picture D, E, F, they are the cut sections of these three pictures. We look from here. Cut it in this area, this area, this area, and we look it from up. This picture somewhat resembles depression. depression from both sides. Depression from both sides. Partition we call it. Partition. Partition. This partition in the pharynx. This is pharynx, huh? This is pharynx. In the pharynx. This partition is known as tracheoesophageal fold. What comes in your mind? Tracheoesophageal. Trachea, esophagus. Simple. So this fold, tracheoesophageal fold, divide the primordium of the pharynx into two tubes. This tube is divided into two tubes. Anterior becomes larynx, posterior becomes esophagus. How it has been divided? By A, B, C. A corresponds to D, B corresponds to E, C corresponds to F. Now we have from the initial pharynx, we have two tubes, posterior one esophagus, anterior one larynx. Sorry. Any questions? Yep.
What's the meaning of diverticulum? Pouch?
Diverticulum, any pouch-like structure from the membrane. From the membrane. Come here.
Like in the smart.
I'll just explain you. What is this? It is in the membrane, isn't it? If I look it from the behind, this is a pouch. This is a membrane, complete membrane, but this is a pouch going slightly getting out from the membrane. This is the pouch, pocket.
It's like sac?
Yes, sac, pocket, simply pocket. Other name of pocket is pouch. Females, they have pouches, small pouches, isn't it? So pocket is known as pouch. So this is small pocket coming from the pharynx. This is pharynx. Pharynx makes a pocket. It is known as pouch or diverticulum. You understand this picture? If you understand this picture, this is respiratory system. Others is a story. Clear? Anybody has any confusion with this picture cannot go ahead.
We said the bronchial come from this, and the membrane come from the mesenchymal cell. But the alveolar come from which one?
This one. This one. This one. Endothelium. What we call it? Epithelium. All this epithelium is derived from the endoderm. All this epithelium is derived from the endoderm. Yeah. Muscles, cartilages, they are from the mesoderm.
Is it two area to development? One of them in the larynx, it gives bronchialis, and other one in the pharyngeal give esophagus.
Yes. Initial stage is only one tube, pharynx. This pharynx divides into two portions, larynx and esophagus. This is like this. So as you see in our body, here is pharynx. Then if you go little down, anterior is larynx and posterior is esophagus. This setting occurs like this at this stage. Go ahead. If you understand this, go to sleep. Others you can read the literature at home as well. Longitudinal tracheoesophageal folds develop in the laryngotracheal diverticulum. We are talking about these folds. These folds approach each other and fuse to form a partition called tracheoesophageal septum. This is a septum. Yes, sir. Yeah.
Prophetic medicine निकालना था ना? आज exam prophetic medicine को हो रहा है ना?
History of medicine. History of medicine.
हाँ वही history of medicine.
Yes, yes. History of medicine. Yes, 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 yes. Sorry, we are disturbed these days. And people don't want to cooperate with us. But I need cooperation from my students. I don't care about anybody else. These folds approach each other and fuse to form a partition called tracheoesophageal septum. We already talked about this. This septum divides the cranial or upper part of the foregut into ventral part, the laryngotracheal tube, and a dorsal part, oropharynx and esophagus. This is what we already understood. Epithelium lining of the larynx develops from endoderm of the upper end of the laryngotracheal tube. The laryngeal cartilages develop from the mesenchyme connective tissue that is derived from the neural crest cells. Neural crest cells I put here because not all. Some of them they come from the neural crest cells. Actually, they are part of ectoderm. So I just put it here. Sometimes you may go through somewhere and oh, some is from ectoderm. Prof. Mujahid did not tell us. So very negligible part, but I put it here. But major portion from the mesoderm, connective tissue from the mesoderm. Laryngeal epithelium proliferates rapidly, resulting in temporary occlusion of the laryngeal lumen. Recanalization of larynx normally occurs by 10th week. Understand this? Understand this? Confused? Confused? Clear?
Another finale.
No, same. Now forget about the previous pharynx. Let's talk about larynx now and trachea. Okay? Pharynx, esophagus, it's not our topic. Larynx. Larynx. Epithelium in the larynx grows faster, very fast. So fast that it closes the lumen. Close the lumen completely. When it is completely closed, these cells, they start to die again. Those cells which close the lumen of the larynx, they start to die now. And in the 10th week, this lumen reopens.
They will
Shed off these cells. Why we need this? Why it was closed, why it was open? Isn't the nature crazy? Isn't it? But there is a reason. These yes.
To give to a branch of
No. Branch is already there. Branch is already there.
So we dilate the canal.
That is actually $1 million answer. You may not reach there. This lumen cells, epithelial cells, increases, close the lumen, then they start to die, and lumen is open. We call this procedure recanalization. Opening back of the lumen is recanalization. When these cells die, which block the lumen completely, 95% of cells, they die. 5% of these cells, they remain there to make the vocal cords, other folds and glands of the trachea. Got my point? Got my point? These cells increase in number, so much in number that they close the tube, then they start to die. Almost 95% cells, they die, but some of the cells, they remain there and they make the folds like what? Vocal cords. They make the glands, laryngeal and tracheal glands. This is the reason why they are closed, then they recanalize. Clear?
What happens to the dead cells?
Regenerated, reabsorb in the amniotic fluid, in the process going on. Recanalization of larynx normally occurs by the 10th week. Laryngeal ventricles form during this recanalization. These recesses are bounded by folds of mucous membrane that become the vocal folds and vestibular folds. This is the function of those cells. Yes?
I'm sorry, but it doesn't make sense. Why included?
That's why I said nature is crazy here. No, it makes sense. It makes sense. It makes sense.
The other organs and gland can be developed.
All the tubes, when the glands are formed, they are formed in this way in all the body. For example, you did not study about the gastrointestinal system, isn't it? Similar things happen in the most of the area. For example, esophagus. It happens like this. It is closed, then it opens. When it opens, cells they die, and remaining cells they make the glands of the GI tract. One more, I don't remember. Endocrine also. One more area where this recanalization occurs. One more organ.
Urogenital? Pancreas?
Yes, maybe in urogenital it is like that. Well, if it comes in my mind, I'll tell you. So, some more organs are like, but GIT for sure, it happens like this. Okay. Epiglottis. Epiglottis, why I put here, because it's a very important organ in the larynx. What's the function of epiglottis?
Open and close.
During eating and drinking, it keeps the air passage protected by, to be ingested into the airway. Epiglottis develops from the lower part of the hypopharyngeal eminence. Have you ever heard this word, hypopharyngeal eminence? Don't be scared. Hypopharyngeal eminence. Ever heard about this? No. I'm sure no. So don't be scared. It's not in your topic, but just to tell you about the development of the epiglottis, this hypopharyngeal eminence, if I show you this picture, this egg-like structure is hypopharyngeal eminence. You can find another rounded ball-like structures, lemon-like structures up there. These four structures, they collectively form the tongue. Tongue is not our topic today. It's a separate thing. This hypopharyngeal eminence, it has two portions, upper and lower. Upper portion of the hypopharyngeal eminence, it forms the posterior part of the tongue, and lower portion of the hypopharyngeal eminence, it forms the epiglottis. And this is the tracheal opening. So epiglottis is forming near to the opening of the larynx. Epiglottis develops from the caudal or lower part of the hypopharyngeal eminence. The rostral or upper part of this eminence forms the posterior third or pharyngeal part of the tongue. Growth of the larynx and epiglottis is rapid during the first 3 years after birth. By this time, the epiglottis has reached its adult form. By 3 years, it reaches almost in the adult form. Endoderm lining of the laryngotracheal tube distal to the larynx differentiates into epithelium and glands of the trachea and pulmonary epithelium. Cartilages, connective tissue, and muscles of the trachea are derived from the connective tissues, mesenchyme connective tissues surrounding the laryngeal tube. We already talked about this. As I told you earlier, initial slides, pharynx, this pharynx divides into two tubes. What are those? Anterior is larynx, posterior is esophagus. Or we can say in adults, anterior is trachea, posterior is esophagus. This tube has to divide into two tubes, isn't it? Complete tubes. This one tube has to divide into two complete tubes. What happens if this one tube does not divide into two complete tubes?
Choking.
The trachea or the esophagus will not be fully developed.
The trachea and esophagus will not be fully developed, or a communication between trachea and esophagus is there. If it is not completely divided, there might be a communication. Any abnormal communication between two sacs or two tubes, any abnormal, not normal, normal communications are there. Two noses have communication there, it's normal, isn't it? But any abnormal communication between two sacs or two tubes known as fistula. If this abnormal communication is between trachea and esophagus, we call it tracheoesophageal fistula.
Two sacs.
Yes. Sometimes vagina and urinary bladder has an abnormal communication due to damage to the vaginal wall. This is known as vesicovaginal fistula.
It's not congenital.
Abnormal. If it is abnormal, or I'm talking about, I'm not going into the detail, but that is known as fistula. So there are many other abnormal fistulas can be formed. They are abnormality, not normal, they are pathology. Similarly, this is a pathology. These are the four kinds of this abnormality or tracheoesophageal fistula. For example, esophagus atresia, esophagus is closed here. Trachea, this is esophagus. What would do? Baby cannot eat or drink. Whatever mother, immediate surgery after birth is required. This condition, you see, esophagus, trachea. You see, these two tubes have to be separated completely. If they are not separated, due to this partition problem, it may occur like this, or it may occur like esophagus is closed here, baby is eating or drinking, cannot eat of course at this stage, drinking the milk, milk is going into the trachea, or this one. These are the different types of tracheoesophageal fistula. Abnormal passage between the trachea and esophagus, it occurs once in 3,000 to 4,500 live births. Most affected infants are males. We are not going into the detail, maybe genetically they are not stronger in this case. In more than 85% of cases, the fistula is associated with esophageal atresia, esophageal close. It results from incomplete division of the cranial part of the foregut into respiratory and esophageal parts. Clear this point? Yes.
What's the clinical presentation in the patient, in the infants?
Give milk, because if it goes into the trachea, baby will be coughing severely. A small drop of water when goes into your larynx, you know that. And if it is separate, not into the trachea, but the esophagus is closed, drink some vomiting. Drink some vomiting. Within few minutes, doctors will know that what's going wrong there. Few minutes. Tracheal bud divides into two outpouchings called primary bronchial buds. These buds grow, we are still in the story. These buds grow laterally into the pericardio-peritoneal canals, the primordia of the pleural cavities. Bronchial buds differentiate into the bronchi. This one. Connection of each bronchial bud with the trachea enlarges to form the primordium of a main bronchus. The right main bronchus is slightly larger as in adults. and is more oriented more vertically. The embryonic relationship persists in the adults. We know this. The main bronchi subdivide into secondary bronchi that form lobar, segmental, and intersegmental branches. We already talked about this earlier. Like they start like this, grow like this, grow like this, grow like this. So you can see.
It expand or the same recanalization? It expand or recanalization? The lung?
No. Lungs are not recanalizing because they are formed later. These structures, they are not completely formed at this stage.
Recanalize happen in the first step.
In the 10th week recanalization of the larynx and some portion of the trachea, it is over now. Okay. Just for your explanation here, these are the air passages, and these pink colors are the connective tissues. These connective tissues are going to form the musculature and the blah 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 connective tissues. Okay. But this is the concept. Make the concept that it grows like 3 lobes in the right side, 2 lobes on the left side. This is how it grows. Segmental bronchi, 10 on the right side, 8 or 9 in the left lung, begin to form by the 7th week. The surrounding connective tissue also divides. Each segmental bronchus with its surrounding mass of connective tissue is the primordium of a bronchopulmonary segment. By 24 weeks, about 17 orders of branches have formed and respiratory bronchioles have developed. An additional 7 orders of airways. This is all a story. As the bronchi develop, the cartilaginous plates develop from the surrounding connective tissue. Cartilages. Will they be able to understand anything? Bronchial muscle and pulmonary connective tissue and capillaries are also derived from this connective tissue, right, which we discussed earlier. As the lungs develop, they acquire a layer of visceral pleura from connective tissue. The thoracic body wall becomes lined by a layer of parietal pleura derived from the somatic mesoderm. This is a type of mesoderm again. I just put the name. So look, this picture is important. This is the developing lung, right and left. This layer is visceral pleura, and this is the thoracic wall. This is the thoracic wall, and this layer is parietal pleura, and this is the pleural space. This is the pleural space. Right lung, left lung. Initial stages, they appear like this. This is how lungs are developed. Maturation of the lungs, as I told you earlier, it is not matured. Lung is not matured until 7 to 8 years of age after birth. 7 to 8 years after birth. I can tell you 95% of the alveoli, they are formed after birth. So only 5%, 1/6 of the whole alveoli, they are present at birth. 95% they develop after the birth during first 8 years. So maturation of lungs, it takes place in 4 stages. 4 stages: pseudoglandular period, canalicular period, saccular period, terminal saccular period, and alveolar period. What comes in your mind? Pseudoglandular period. Pseudo?
Similar to gland.
Similar to gland. Pseudo, false gland. If you look the lung of this stage is 6 to 16 weeks. If I take out the gland and give it to you, what is this structure in the human body? You will say, well, this is a gland. It does not appear like a lung. This is known as pseudoglandular stage, period. Second one, canalicular. What comes in your mind? Canal. Canals, tubes are formed. Saccular, terminal saccular period. Sacs, pouches, they are formed. Saccular, saccule-like structure. And alveolar, alveoli are formed. So these are the 4 stages. Understand? Little bit literature and story about these 4. Pseudoglandular period 6 to 16 weeks. Developing lungs somewhat resemble an exocrine gland during this period. By 16 weeks, all major elements of the lung have formed except those involved in the gas exchange. Lung is almost formed by 16 weeks, but gas exchange area is not developed. If gas exchange area is not developed,
No complication.
baby if born 16 weeks cannot survive because gas exchange cannot take place, so cannot survive in any case. Fetus is born during this period cannot survive, respiration is not possible in pseudoglandular period. Canalicular period 16 to 26 weeks. Cranial segments of the lungs mature faster than the caudal ones. Lumina of bronchi, lumen canals of bronchi and terminal bronchioles become larger. Lung tissue becomes vascularized, highly vascular vessels are formed. By 24 weeks, each terminal bronchiole has given rise to 2 or more respiratory bronchioles. The story. Each of the respiratory bronchioles divide into 3 to 6 tubular passages called alveolar ducts. Respiration is possible, not here, but here. At the end. Respiration is possible at the end of this period here. Because some thin-walled terminal sacs, primordium of the alveoli, have developed at the end of respiratory bronchioles, lung tissue is vascularized. Fetus born at the end of this period may survive if given some support.
Corticosteroids?
No, incubator is enough. Don't go for steroids at this age. Huh? Incubator, we have incubators developed. Yes, somebody was asking.
Is it related to surfactants?
Very good. Yes, because surfactant starts to develop at week 20. Surfactant starts to develop at week 20. By week 26, it is somewhat not sufficient. So if the baby is born at week 26, if we give this baby a support, external support like incubator, then baby may survive. But if we don't give the support, baby may not survive.
It disappears in month 8.
With surfactant?
Yes.
No, it is present in you as well.
No, I mean in the fetus.
No. Surfactant once start to develop by week 20, it is continue to develop until the person dies.
I hear in 8th month it's disappeared. It's appeared in 7, 8 months disappear, 9 months it will be.
Yeah, because last year you mentioned that if the baby born within 6 months, he will survive because surfactants is already developed. But in month 7, he won't. But it will be back at.
I would be a big liar if I say some words like this.
Month 8.
I would be a big liar if I say these words. The surfactant disappear in the week 7.
Not severe, but.
Mind my words in this camera. I blame myself. I would be a big liar if I ever said the surfactant is diminish or decrease at week 7 or 8. Not at all. Maybe I said you something else because once surfactant has started, surfactant is the life of the lungs in you and me as well. If we are deficient of surfactant now, lungs will collapse immediately.
Essential stage.
Essential for the lungs function, surfactant cannot be. Maybe I said something else. It's not. Yes. Bring me. I accept that I am a big liar if I say like this. It starts to develop because it should be keep increasing. When the baby is mature stage before birth, yalla. So it is increasing and it never stops. Surfactant never stops or reduced. Lung tissue is well vascularized. Fetus born at this period may survive. Many more terminal sacules develop. This canalicular, now saccular period. Many more terminal sacules develop. Their epithelium becomes very thin. Capillaries begin to bulge into the developing alveoli. As I said, the lung tissues are vascularized. Capillaries are developing here. So these capillaries, for example, this is the epithelium or wall of the alveoli or sacules. They bulge. You can see the bulge of the blood vessels like this. Their epithelium becomes very thin, capillaries begin to bulge and developing the alveoli. By 26 weeks, the terminal sacules are lined by squamous epithelial cells of endodermal origin, type 1 pneumocytes. These are known as type 1 pneumocytes. When I say type 1 pneumocytes, it must be their type 2 pneumocytes. Otherwise, simply we could have said that pneumocytes. So what's the function of type 2 pneumocytes? They secrete the surfactants. Very good. Gas exchange occurs across type 1 pneumocytes. Scattered among the squamous epithelial cells are rounded secretory epithelial cells, type 2 alveolar cells or pneumocytes. Type 2 pneumocytes secrete a mixture of phospholipids called surfactant. So it means that by the 7th or 8th week, the type 2 cells, they disappear. No. Cannot be. Surfactant forms as a monomolecular film over the internal walls of the terminal sacules. Surfactant production increases during the terminal stages of pregnancy. Increases, cannot be decreased. Surfactant reduces surface tension and facilitates expansion of the terminal sacules. This is life. Surfactant is life. If it is not there, how big is the lung cannot function. Fetus is born prematurely at 24 to 26 weeks may survive if given intensive care. Fetuses may suffer from respiratory distress due to surfactant deficiency. If fetus has surfactant deficiency, if baby is born with surfactant deficiency, respiratory distress may occur and death may occur. So surfactant is life. Surfactant production begins by week 20. By 26 to 28 weeks, the fetus usually weighs about 1000 gram or 100 kg. So for example, if the baby is born at this age, 1 kg, very small, so it needs a support to survive. Weight is low, surfactant must be less, lung is not matured, but if you give a proper support, it may survive. Sufficient terminal sacules and surfactants are present to permit survival of a prematurely born infants. Pulmonary vasculature and sufficient surfactant are critical to the survival of the premature infant. Surfactant everywhere. Alveolar period. This is important. Until 8 years after birth. These are the 4 stages of lung maturation. Pseudoglandular, canalicular, sacular, terminal sacular, and alveolar. Definition of the term alveolus depends on the change of terminal sacular period to alveolar period. Structure similar to alveoli are present at 32 week sacules. The epithelial lining of the terminal sacs attenuates to an external, extremely thin squamous epithelial layer. Type 1 pneumocytes become so thin that they adjacent capillaries bulge into the terminal sacules. We already talked about this. At the beginning of the alveolar period, each respiratory bronchiole terminates in a cluster of thin-walled terminal sac, bag-like structure, separated from one another by a loose connective tissue. These terminal sacules represent future alveolar ducts, and these alveolar ducts, they open into the alveoli. Very important slide. As you know, in the cardiovascular system, that there is a communication. Yes, finish.
वो यहाँ पर नहीं मेरा पिक है
यहाँ पर है?
हाँ
3 minutes. Two atria are in contact. Atrial, he took away my mind. Allahumma salli ala. Interventricular foramen, interatrial foramen. These are the communication between the two atria and two ventricles. So it may mix up pure and impure blood, but in the fetus there is no impure and pure blood. The oxygen is coming from the mother. At the time of birth, these two foramina have to close, isn't it? Yeah. Otherwise there is an abnormality. This is what we said here. Transition from dependence on the placenta until birth, a minute or seconds before birth, the fetus is dependent on placenta for the oxygen, isn't it? So transition from placenta to lungs. The time baby is born, this transition happens. For gas exchange to automatic gas exchange requires the following adaptive changes in the lungs: production of adequate surfactant in the alveoli, transformation of the lungs from secretory into gas exchange organs immediately, establishment of parallel pulmonary and systemic circulation. Atrial septum close, ventricular septum close, ductus arteriosus close, and pulmonary arteries in function at the time of birth. This is here. Mandatory. If this does not happen, difficult for baby to survive. Characteristic mature alveoli do not form until after birth. 95% of alveoli develop postnatally. Most increase in the size of the lungs result from an increase in the number of alveoli, not the size, number. The alveoli are not present. 95% of alveoli, they form after birth. I don't say that they are present and they become large or mature. No, they form after birth. Story. Breathing movements, I told you earlier, occur before birth, exerting sufficient force to cause aspiration of some amniotic fluid into the lungs. These breathing movements only be observed by ultrasonography. At birth, the lungs are half filled with the fluid derived from the amniotic cavity, lungs and tracheal glands. So lungs are filled. At the time of birth, when the baby squeezes out of the narrow birth canal, this birth canal compresses the chest very hard. When it compresses the chest very hard, the amniotic fluid which is accumulated in the lungs comes out from the nose and mouth. Through the mouth and nose, by pressure of the fetal thorax during delivery, the fluid in the lungs is cleared. Into the pulmonary capillaries, it is absorbed, and into the lymphatics and pulmonary arteries and veins. This is how this fluid which is accumulated in the lungs during the fetal life, it is being taken out. 3 factors are important for normal lung development: adequate thoracic space for lung growth, fetal breathing movements, adequate amniotic fluid volume. If these 3 things are going normal, respiratory system will grow, will develop normally. That's it.
Thank you.